as I mentioned earlier, and the governor has mentioned, we have now 86, which is 64% of our total amount. And the breakdown for those 86 individuals that have fully recovered are as follows. 0 to 9 years old, none. 10 to 19 years old of age, 6. 20 to 29 years of age, 11. 30 to 39 years of age, 10. 40 to 49 years of age, 19. 50 to 59 years of age, 12. 60 to 69 years, 17. 70 to 79 years of age, 7. 80 to 89 years of age, 3. 90 and above, 1. In regards to the sex breakdown, we have 47 as females and 39 males. In regards to the regional distribution of where they reside, 30 live at northern, 41 at the central region of the island, 15 at the southern. And travel-related history, 15 that have recovered have travel-related history, and 37 do not, and 34 are yet to be determined. Thank you, Governor.
Thank you, Linda. We're open for questions now.
Again, I'd like to remind everybody you get one question and one follow-up. We'll begin with KOAM, Nestor Lecanto.
Thank you. Good afternoon, Governor. Good afternoon, Linda. My question for the governor, and we just got a release from the SBA, and they issued a statement attributed to Treasury Secretary Stephen Mnuchin and small SBA Administrator Carranza. And if you'll indulge me, let me just read 2 sentences here. By law, the SBA will not be able to issue new loan approvals once the programs experience a lapse in appropriations. We urge Congress to appropriate additional funds for the Paycheck Protection Program, a critical and overwhelming bipartisan program, at which point we will once again be able to process loan applications, issue loan numbers, and protect millions more paychecks. As you know, the PPP and the EIDL have been relied on heavily by our local small businesses. I'm wondering if you had a comment on that, if in fact the Congress does not appropriate any more money.
Right now, I know that we have, I think, about 53 million already in loans for the PP protection program, and I know that the SBA also has been doing the EIDL loans, and so like I said, right now we have in the coffers 53 million. I don't really know if that's all been distributed, Nestor, but certainly if the funding source is not there, then we can't continue on with the program, and we'll just have to work with Congress to provide more funding availability of funding sources for the program. But we have 53 million already, and I think that equates. I'm trying to find my information on that in terms of how much businesses that is. So let me see. Okay, so we do have 53.6 million for the SBA, the PPP program. And nationwide, there's like $247 billion that's already been approved. So for our loans for PPP, we have approved 238 businesses. I think that is a big amount of loans that have been approved. I don't know if that is, I don't know what's pending. I don't know how many, but we certainly will be in the line for those loans to be funded again.
All right, thank you, Governor. Second question is, I know you probably at this point, based on your previous statements, believe it's a little, might be a little too early, but have you at least thought about bringing in some economic advisors and starting to make plans to restore our economy once we do finally emerge from this coronavirus crisis?
Sure. Yes, I have. Actually, our economy cannot be restored Nestor, unless, of course, we have the health and safety of our community. And so that has always been our focus. But the concern about the health of the economy has always been along with that focus. I am establishing a panel of individuals, representative from the government, the private sector, economists, also along with our medical advisor. And that's going to be my recovery panel advisors. And at those meetings, we will be discussing strategies and the methods and how we will move forward with the recovery period. It would heavily involve data. It would heavily involve how our hospital capacity is. It would also look at how good our contact tracing and surveillance will be, and our capacity and expansion of testing. Those are some of the key indicators that I would have to be looking at in order to feel like and trigger recovery into the recovery phase.
Thank you, Nestor. Next is K57, Patty Arroyo.
Good afternoon, Governor. Thank you very much. I have a question about whether or not CDC is coming to probe the situation on the Theodore Roosevelt.
I don't know specifically CDC. I do know there's medical people. I do know that they've been investigating it through their epidemiologists in the military, Patty. They do have epidemiologists, and they do have on the base, CDC personnel also. But I don't know if there's going to be a special group of federal CDC members that would be coming. I do know, though, that they have involved their epidemiologists in this situation.
Right, and in communication, may I, Governor? Sure. In communication with US CDC, I know of 2 individuals that are coming, but it's for the Department of Public Health and Social Services to assist us in our efforts. And one of them has already been here, and she went back, but she will be returning. And we've got approval of 2 personnel that will be here. That's my only knowledge as far as US CDC personnel.
Okay. Gosh, I have like 5 other questions, but I have to choose one. Hang on. We were in receipt of a news story this morning, a national news story about the same Korean Solgen company that is sending hundreds of thousands of test kits. The same company that we were not considering to be up to the standards by FEMA. They're sending to the US. Has there been any additional information that we should know about the approval of these kits from that same company that the US is receiving in the hundreds of thousands?
Yeah, we get a listing of all these diagnostic and test equipment, and that's updated continuously. We get that listing from FEMA. And as far as I'm concerned, it's still being, it's not yet reviewed as far as being approved for an EUA, which is the Emergency Utilization Authorization at this point in time. And it's not right, and it's not FDA approved. So until we get that listing, and it has it in that listing, then things will change, and we'll be notified of it.
Thank you, Patty. Guam Daily Post, John O'Connor.
Thank you, Governor. How are you?
Good, thank you, John.
Yes, Governor. Clearly, as we responded to the COVID-19 pandemic, we've instituted the cooperation of various entities, including the quarantine facilities and Tier 1, Tier 2, Tier 3 medical facilities. Is the government continuing to pay for all these facilities? As I think Linda mentioned that we only had about 108 people left in the quarantine facility. So is the government continuing to pay for all these facilities, even though they may not be fully occupied? And were there contracts and agreements signed with the government in order to use these facilities?
Yes, All the quarantine facilities that are run by the government have contracts, and the contracts have been signed. We are on a lease agreement with them. We not only have lease agreements for the facilities, but also we do also provide services to these individuals that are quarantined. We provide them meal services, we provide them laundry services, and we also provide them medical checkup services and evaluations. So all those, John, are being paid by the government.
Your follow-up, John?
Thank you, Governor. So today, the legislature may vote on Bill 335, the curfew measure. Yesterday, you talked about how you might enforce that measure, but Bill 334, the penalties measure, isn't on the legislative agenda. You did say that you've consulted with your legal authorities and on what you can do with your existing authorities. So if you do institute a curfew, what penalties might people face if they don't follow that curfew authorized to you under Bill 335?
So I have not seen the final version of the bill. I think they are scheduled to vote on the bill. So whatever the legislature has put forth in the bill in terms of penalties, fines, and fees, if there's any, that would be what I would follow.
Thank you, John. Next is I-94, Adriana Cotero.
Hi, Governor. Hi, Linda. Sorry, I can't see who all is present. Is your video down to the media? Is Admiral Manoni there? I can't tell.
Admiral
No, he's
Manoni
not.
is not here.
Oh, okay. Okay, so then for my first question, I want to go back to mass testing. I know the administration has said they are against South Korea's rapid test kits because they are not yet FDA approved and they're not diagnosis-based kits, but they are surveillance, and not only are they being used in the CNMI in the US, but also multiple other countries. And, you know, we all know that with South Korea, they flattened their curve early on. So can I just get a clear answer on specifically the reason to be against the kits? Even if they are just for surveillance, that can determine beneficial information. And is there really a limitation on humanitarian aid? And with that, how accurate are our tests on diagnosis?
So again, as I have said numerous times, that test kits that we have accepted are test kits, Ariana, that are that are FDA approved test kits. We are increasing our capacity to mass test. We now have 2 machines that can do test results within 15 minutes. We have our regular machine, and then we will also be getting machines from GRMC where they can do test results within 2 hours. We are also going to be getting more of the ABI ID now point of care machine. This is the one that does the rapid testing. As soon as we get all of that, we will be expanding our capacity and our ability to test more. Again, having those non-approved FDA tests, having those not gone through any kind of US standards testing, and if the United States decides to put it on their FDA approved list, then of course we will use it. But I am guided more by the standards and by the scrutiny and exams of these tests to come to a much more reliable, accurate. So the tests that we are doing now, I am very confident in their reliability of the results because, like I said, it has gone through the scrutiny and examination and evaluation of US standards.
Yeah, and in addition to what the governor is saying too, we have the Gene Expert machine, and GRMC is also going to have that machine. And again, we already have 4,600 test kits that have been already earmarked for Guam. And again, we're getting test kits as far as what we know in regards to the Abbott. And as the governor indicated, we've already requested for several more through FEMA.
Your follow-up?
Okay, so As I'm sure you know, Governor, the Office of the Attorney General has implemented a crime spectrum to follow for prosecution during the pandemic. And this being non-violent offenders being booked and released, and at the other end, violent offenders being booked and confined. There was a recent incident with 2 offenders being released and falling in the middle of the spectrum. However, they had made death threats to a family. They were charged with terrorizing and criminal mischief. There was property damage and home invasion, yet they were released, and now victims, they're feeling like they're left in fear and feeling victimized by the criminal justice system. So what are your thoughts on this issue at hand?
My thoughts were this, I was not aware of this until earlier yesterday. So I asked my legal counsel to work with the courts. The whole focus on this, Ariana, is so that we can also make sure that our DOC population is not increased in any of the exposure possibilities. I am concerned that these 2 arrestees, it may not be violent, but I was not very happy that they were released. And we are working closely with the courts also to look at what are some of the things that we could put in to again protect the DOC from exposure. And some of that would be, one of that I am thinking about is to test these people before they are confined. So, and also to make sure that at the DOC, there is a designated building that's solely for possible COVID PUIs and for isolation and quarantine. So we need to institute that. And I totally understand the feelings of our community, of their insecurity, and this crime to me is not a minor crime. To me, I see it as a much more violent crime. And we are working with the courts to have a much better clarity on it.
Thank you, Adriana. The point, Nick Delgado.
Hi, Governor. Can you hear me?
Sure.
Good afternoon. So, Governor, back to the testings, you mentioned a strategy for mass testing during your Facebook Live today. You said that mass testing would first begin with those on the front lines in healthcare and then move out to the community. So, how soon do you anticipate that happening? And has your administration already started ordering large quantities of test kits? And again, as my colleagues asked before, they potentially run out. Are we going to revisit getting those kits from South Korea that even FEMA now has a contract with to get tests stateside?
Okay, so I'm not going to revisit South Korea. That's a dead issue for me, unless it comes into the list of FDA approved. We are working feverishly, Nick, to get those tests that are FDA approved, and we are getting them. So I do know already that with our healthcare workers at the hospital, they've already tested about 150 people, and GRMC is in the process of also testing their healthcare. I'd like to go out and test the frontliners, their GFD police officers, the public health people that are out there, and so forth, and then move them out to the community. Once we get those supplies, and Linda has assured me that there is going to be a continuous source of supply for those rapid test machines, then we will do that. But I am not going to revisit the South Korea one because it's not FDA approved. Do you want to add anything?
Yeah, and on top of that, we're still waiting for more supplies. So we've been in contact with CDC, and so I keep them abreast as far as how we're doing with our test kits, and we're getting the IRR to provide the test kits to us, and so we are constantly requesting for more. The minute we get one test kit, we request for another one right away.
Thank you. And so
I would rather build our capacity with the FDA approved tools. That's
Right.
my bottom line.
Right. And
No doubt.
yeah, and once we get to that level, that would also help us with our incidence and prevalence level in regards to the entire community.
Okay, thanks for the response. We'll see how that goes. My second question, last night we worked with your office on a case involving a retired veteran who was told by your COVID hotline operator they would only need a doctor's clearance and not an actual negative test to be able to go home after they arrived from a flight from Hawaii. Then earlier this month, one of your cabinet members who we verified later tested positive for the virus after coming from Hawaii was allowed to go immediately home without a negative test result whenever they arrived. So with all this confusion, what's your response to those cases, and what's the actual guidelines in place so people know whether they are going to be quarantined at a hotel or they can go home?
Yeah.
The protocol remains the same, that and that we also look at assuring that the public is not endangered at all. We have made exceptions to several situations, and I'm not going to go into any details about it because it's protection of privacy of our individuals. But I want to assure the people that our protocol has not been compromised, and the protection of the safety and protection of our public has not been endangered. And so those individuals that have been sent home for home isolation or home quarantine are being monitored by public health. So you want to?
Yes, I will. I will definitely. In regards to yesterday that you're implying about the veteran, what had happened is everyone that comes out of the aircraft, they have to fill in the voluntary quarantine. There are exceptions if they have certain conditions, so certain comorbidity conditions, including behavioral health conditions. And again, I won't elaborate on the particular individual, what transpired, but when we have those type of information that it's deemed to be in our listing of home quarantine, and of course with the justification with medical records in place and medical documents that are submitted, I was able to retrieve and obtain that information through a physician. And from there, I looked at the records, and then I immediately felt that it was in line with our quarantine protocol. And so that individual then went from the home quarantine, the quarantine at the government of Guam facility, which is at Pacific Star. And then we also moved them into the home quarantine. And those, like I will report when I go to court. The judge always asks me about those cases, and I also indicated that that has happened in the past when we had also the airline coming in, because we had passengers in the past, as I reported in court, that had just came out of surgery, and they were seen at St. Luke's, and they were very much in need of, they had all these morbid conditions. And so those were exemptions that were also made. Public health ultimately makes that determination based upon all the information we get. And then I instigated to have one of our staff to go to that quarantine site to look at everything and talk to the individual as well, make sure everything is in order, the home is conducive for home quarantine. And after all that is done, that was taken care of, and the individual did go home, and everything was documented. So I hope that answers your question.
Thank you, Nick. Mariana's Business Journal, Maureen Maritita.
Yes, good afternoon. When you talk about governor, when you talk about a gradual return to any sort of economic activity, what would that involve? Would that involve opening certain stores or reducing checkpoints? How do you see that developing?
Right. Based again on what our resources and the indicators that would trigger that, I would gradually lift restrictions. And I have not thoroughly decided what those are. This is something that our recovery panel would be advising me on. But I was thinking more in the line of, yes, maybe we lift the roadblocks, and then maybe we lift the restrictions against dining in at restaurants. But if that is lifted, possibly we would make some conditions, like maybe 50% of occupancy can be allowed in these dining ins, no stand-up bars. Those are the kinds of things that we would be discussing. I would be very cautious about social gatherings of a large number, because as you can see, the virus is contaminated and does transmission and contamination through social contact. And that's one of the ways that we need to continue enforcing as much as we can. And I will be monitoring also based on the monitoring the infection rate. Are we seeing more infections? Are we continuing to maintain the infections at a very, very, very low trajectory? These are some of the things we would have to be continuous doing. We continue also doing contact tracing. We will continue surveillance out there through public health. We would continue our education about washing your hands for, I would say, a few months. And then we, again, continuously will monitor the data.
Okay, thank you. So my second question about test kits, but not the South Korean ones. So testing every resident is the gold standard. That's understood. So what are the projections for how long that would take on Guam?
Well, if we have all the equipment that we have in our laboratory at the public health laboratory. We have about 4 equipments. We can run those, and with adequate personnel, of course, we can get them all done within a time frame. We would have to compute as far as the overall 167,000 individuals that we have, and then we'd have to figure out, we're going to figure out the incidence and prevalence rate of everybody being tested. That can be done. But in terms of how long it's going to take, we are going to have to figure out if we have all the 4 machines running simultaneously, then we're going to have to go by each hour, how many, that's all going to have to be computed. So I would say maybe a month or 2 more, or even maybe up till August.
So Maureen, I think when we do the recovery phase, like I said, we would have to be doing mass testing. And this is one of the things that we have discussed in our team. And that is, what's mass testing mean? Does it mean every single person, or does it mean a certain number of people within a population that you can feel comfortable that community spread is no longer there? So the doctors are still debating that. There is no real guidelines from CDC on it. I think it depends on your situation, depends on your environment, where you're at. Were you one of the hot spots? Were you one of the slower ones? Did you ever reach the peak? Those are some of the factors that need to be discussed. So mass testing may not necessarily mean every person, but it may mean a certain percentage of our population that's tested to feel confident that we have contained the spread. And of course, 18 months from now is what people are saying vaccine can be available. And once we get the vaccines, that would also be a much more assurance in terms of decrease in community spread.
Thanks, Maureen. PNC, Kevin Kerrigan.
Hi, good afternoon. I have a testing question as well. As you all know, it's been a couple of days during which none of the 60+ people tested by public health has tested positive, although there have been a few clinical and BLS positive. But why aren't we finding more positives? Are we not testing the right group of people, or not doing enough testing, or could it be the experts are wrong and we've passed the peak?
Yes,
yeah, go ahead.
I've asked the lab that. I just wanted to clarify that we are also doing the testing also through DLS, and our data shows that from April 3rd all the way through the 15th, we've done a total of 149 tests. And those tests usually, as I mentioned, the priority ones are the ones we do at our laboratory, and those that are at the lower end of the priority, such as those that are asymptomatic, we most likely get them through DLS. And our data shows that so far we have 5 positives on that time frame, and the results are still coming back. We have not yet gotten all the results. And mind you, it's because of the fact that we have patients that all their swabs have gone to either Hawaii or either the commercial lab, which is in the Quest laboratory. And so we're still getting that information as we speak. And also the fact that we get these tests, and again, it's the providers. They go to the facilities, they go and they get their tests done, and they're the ones that will provide that information to us. Now, maybe they're listening to the governor and everybody else, they could be staying home and they're not coming forward. And again, that's why it's so important for us at the Department of Public Health to reiterate, and we did in the past, that if we do our surveillance, our contact follow-up, and our contact tracing, that please don't wait for us to call you. Please come forward if you are part of any clusters that you can help us. Because again, we're dealing with all these tracing and contact follow-up, and we don't want to, take time, and it does amount with a lot of massive work that we have to get through to do all this type of surveillance. And for that reason, we are asking the community to come forward, and so far that's what we're seeing. Governor would like to add some more?
Yes. I was just trying to find our total amount that we've tested.
Yeah.
So there's a total amount of about 900. There's been a total number of tests performed, Kevin, that are 972. So we're close to testing 1,000 since we started on March 12th.
And then we added
yes, and you do know also that the more we test, the more infection rate we'll probably see. That's just a mathematical calculation issue. So I do expect that if we do more tests out there and not just those 5 priority people, then I do expect to see more positives. How much more of that in comparison to the graph and the data that we will be tracking? Do we have good surveillance out there? Do we have good contact tracing out there? Do we have adequate capacity for our hospital in case there is a surge? Those are all the factors that we would be looking at. So the progression of the testing is dependent on the supply. And because earlier we were so limited in supply, we wanted to just catch the much more critical and the much more serious, the symptomatic ones and so forth. Now that we can have more leeway in the number of testing supplies, we will be testing more. And I can guarantee you we'll see more infection rate.
Okay,
and
thank you.
also has to do with asymptomatic.
Yeah.
And a lot of people, when they're asymptomatic, they feel fine, and they don't want to, they don't think they have anything. Also, we're going through the respiratory illnesses. The flu has a certain season too, and I've been told by the laboratory as well that we're getting over that area in terms of capturing those that have flu-like symptoms, and that has diminished quite a bit according to the laboratory staff.
Thank you. As a follow-up question, President Trump this morning indicated the possibility of easing some of the social distancing restrictions stateside before May 1st. Governor, has there been any change of heart on your part to easing restrictions before that date, or even extending them beyond, I think it's May 5th that you've set right now?
I will say I will not ease it before May 5th. I'm actually looking at May 5th, Kevin, to see if we can start easing it after May 5th. And again, it's dependent on what we're seeing in these next 3 to 4 weeks. If we continue on the slow trajectory, on the low trajectory, because of the measures that we have put forward, then I would feel after May 5th that we can start maybe easing some of these restrictions, but I'm not going to do it before May 5th.
Thank you, Kevin. PDN, Steve Limtiaku.
Yes. Oh, hi, Governor. Hello.
Hi, Steve.
Yes, hi. Again, still on the mass testing. You mentioned earlier today that you're waiting until Guam receives a comfortable number of testing supplies before you would start any sort of mass testing. Have you determined what that number is? Like, how many tests do you want on hand before we can start that? And is it accurate to say you still haven't decided how the mass testing would be conducted?
Okay, so the numbers, I'm not, I don't want to get a definite number, but I do know that we did test so far 972 with the machines. It's actually one machine and maybe some help from DLS and the military, but not by much. And so if we have that capacity already, and we're saying that we have the supplies that we could have to test the much more critical, the asymptomatic, the hospitals. I need to look at what my admissions are at the hospital. So I would say if we get like 500 tests, we could start doing more mass testing and expanding those capacity for testing. The rapid machine tests can do 200. They come in cartridges, and they do 200. So if we can have 500 on hand, we can do more now. We can now go out to do more of the healthcare workers, the frontliners, and as we continue and build up the supply, we'll go forward more. And as far as mass testing, again, I don't have any guidance on what that definition means. And again, does it mean every person on our island, or does it mean a certain amount that could be representative? Or do we do certain amounts of people from each village? Those are the kinds of things that we haven't yet ironed out, and I'm hoping that we'll get that from the medical advisors, CDC people, guidance, and of course, public health. And our epidemiologists, yes.
Okay, and on a different topic, do you know when residents can start applying for the pandemic unemployment assistance?
When they can start applying?
Yeah.
I think they're already asking people to apply, and I believe you can apply online. So Dave De La Sola got that, I think, all squared away, and he is trying to, I guess, complete the internet system to make sure that things can just flow electronically. But I think you can start applying. I know, Steve, that Dave De La Sola has been reaching out to people, and I think he's told me there's something like he sees something around 8,000 and some already unemployed.
Thank you, Steve. And now for some closing remarks from the
Yes.
governor.
Some superheroes wear masks to protect their identities. Our real life heroes wear masks to protect their lives. These heroes have worked day and night to keep our island healthy. And the least we can do for them is to make sure they are protected. It is no secret that personal protective equipment, or PPEs, are in short supply everywhere. Many health workers have had to abandon usual protocol to reserve their PPEs. Simply put, if we don't have the equipment, we can't keep our front line safe, and our patients will suffer. But in times of crisis, humanity has always come through. PPE for Guam is a volunteer initiative to create PPEs and donate them to medical professionals, first responders, and other individuals who are at high risk of contracting COVID-19. Through their organizing, volunteers are creating production lines for PPEs, which have been in short supply during this pandemic. On April 3rd, PPE for Guam donated 175 sewn masks to the Guam Office of Civil Defense for distribution to the hospitals and first responders. On April 9 and 10, they donated 550 face shields to GMH and GRMC. These face shields were made by local volunteers using 3D printers. Their goal is to create 500 additional face masks and 1,000 more face shields by April 17. I want to thank PPE for Guam for everything that they're doing to help this fight against COVID-19 and for being a COVID hero. Thank you, and please stay home.
Thank you, everybody. We'll see you again tomorrow.